As the coronavirus crisis continues to unfold, many Australians have turned to the media to make sense of what has been an unprecedented and chaotic moment in our history. But health professionals are warning that for those with illness anxiety, a news cycle dominated by medical fears has done little to calm a threat that strikes at the very heart of their concerns.
For someone who might be experiencing anxiety, and those kind of things can be exacerbated by kind of anxiety-provoking media coverage. So you can spend hours scrolling through different media coverage of the same material on an anxious loop.
Greg Armstrong, public health researcher and mental health expert at the University of Melbourne, warns that while informative for some, the coverage of coronavirus has often leaned towards sensationalism, triggering emotional responses for those already suffering from health anxieties.
What sort of tends to happen is that kind of stuff is kind of triggering our kind of amygdala, the part of our brain that really triggers the fight or flight response. It kind of becomes hijacked and you become quite activated. And so it sort of taps into these sort of heightened emotional and behavioural states as opposed to trying to calm them down.
For Lauren Bravo, who has suffered from health anxiety since a young age, the impact of this sensationalism hits close to home.
But of course, those kind of headlines are really scary. Every time you see a headline, it's a reminder to check your body for any sign of symptoms. It can trigger off a real sequence of panic.
Dr. Armstrong points to the recent coverage of suicide during the pandemic as another example of the ways in which the media has impacted those also suffering from pre-existing depression.
It's fairly obvious for us to be concerned about suicide rates during this time, but I guess the media coverage, and it's not just been in Australia, it's been in many countries, has really gone to the next level with really ramping up concerns. And that's actually created a lot of conversation and discomfort within the suicide prevention sector. Our concern with that is that it tends to normalise suicide. It's kind of like this expectation. It's inevitable. It's normalising suicide as a response to strains during the pandemic.
To navigate a news cycle dominated by these mental health triggers, Lauren has regulated her screen time and has chosen to be more discerning of her media consumption, advice which Dr. Armstrong also recommends.
I would advise cutting back your media consumption as far as possible, seeking out sources that you trust, and limiting your consumption to just what they say.
For Dr. Armstrong, cases like Lauren's raise interesting questions about the discussion of mental illness in times of crisis, and highlight the need for more research into how such issues should be reported.
Not to say that we shouldn't be talking about it, but it's how it's spoken about. We definitely need to talk about suicide. That's where we probably need to devote more of the conversation and much more research. We really do need to know more and unpack more and develop guidelines around how best to report. It's more just about a constant process of learning and reflecting on practice.